Chatline as a model for remote undergraduate practicum experiences. Dr. Gideon is an assistant professor of teaching and the faculty director of the undergrad practicum in the program in public health at UC Irvine. He is a medical and psychological anthropologist, and research has focused on the relations between public health discourses, substance use, and HIV/AIDS, particularly among gay men and transgender men. Dr. Gideon's received his PhD from the UC San Diego and an MFA in creative writing from the New School University. With that, I'll turn it over to Dr. Gideons.
Just great, thank you. I'm just trying to make sure that I can, if everyone can see my screen.
I do, I see your screen and I
okay,
hear
good. I'm always doing it in the wrong place. So I've called it, added the overtitle of real-time support, click here, which is what the icon says on our chat site. I want to thank you for having me and us, one of my co-authors is here, and for including this paper among the epidemiology papers, which is, it's close, I guess. And we will talk about, because I'm definitely educating a bunch of future epidemiologists for sure. So some sort of basic background. So this was, several birds, one stone. We were confronted with, like all of us, with multiple unprecedented problems all at once this past March and April, especially those of us at universities. So on March 10th, the Chancellor of UCI, following the chancellors of all the UCs and many, many schools around the country, announced that we would be transitioning to remote learning for the spring quarter. Now, remote means simply that we will not be in the same room at the same time. It is not fully online. The semantics of it are somewhat legal, but basically the students could not be anywhere on campus and they could not be instructed in person. So that meant that practicums, which are required for several majors on campus, had to be remote as well. And that in order to graduate with a public health degree from UCI, you have to do a practicum. And so that 85% of our sites couldn't accommodate remote practicums. That was between, I think, I can't remember exactly, we have between 50 and 60 sites that couldn't do it, which left 10. And the confusion at the same time was rather overwhelming about information-wise. So the operators at UCI Health were overwhelmed with questions, as were all the doctors. Anyone who had any medical knowledge, those of us in this room probably had numerous questions from people that knew us or didn't know us about what was going on. And ultimately what we did was we created a COVID-19 chat line for UCI. And over the last 3 quarters, since April, we've had 50 students intern there. And these are all the icons here were several birds and then we cooked it. So we figured out how to use it all together and make something that worked. So the practicum is basically the important thing to know is that CEF, which is the Committee on Education Public Health, accredits all these many undergraduate programs. They mandate a cumulative experience for undergrad public health majors. That does not necessarily mean an internship. It could be many things, but UCI, it is an internship. So we have 1,300 undergraduates. We have one of the largest programs in the country of undergraduate programs. And that means that we have at any given time over at least 100, but up to 200 seniors in practicums. I have taught that class, I think we're at 17 times, because it's every single quarter, including the summer. So the class is an intensive writing class that is combined and integrated with this 100-hour internship. And the writing includes an article review, a mock NIH grant, and both of those are supposed to focus on things being done or sort of being discussed at your internship, and the policy analysis that they do is directly associated with their with what they have seen while doing there. And the whole point is we have is sort of experiential and meta understanding of the linkage between academic and practice public health. So definitely some of these things are a lot more obvious with putting someone in an actual public health agency, but we also have people working in doctors' offices, working in physical therapy. We have a lot of different ways that people are doing health in the community. And just a quick note is that why I'm using stock photos. Well, I did find a stock photo template of all these people using phones, which is how most people contacted us. But also, we've never seen any of the people that come to our chat line to ask us questions. And also, most of our students don't ever use, as those of you who teach notice, many students don't turn on their cameras. So there are a lot of people that we've worked with over the last several months that I've never seen their faces. So that is sort of why I've covered everyone up, because it seems a little more applicable. So how did we do it? So it was, in many ways, we did it by the seat of our pants. So originally, there was a big discussions between UCI Health, which is a massive sort of medical complex that includes the School of Medicine, but also it is sort of the major hospital for Orange County. And they were trying to discuss with us and public health, the program, what to do with all of the calls, all of the information, and also all of our students that needed internships. Originally, this was going to be this integration thing, and then it became clear that UCI Health was really busy doing things like saving lives, and the idea of creating something instantaneously was not going to happen. So we just did it ourselves. Basically, through the idea of Dr. Runnerstrom, who's on this paper as well, and Dean Bodonabala, we decided to do it and persuaded the university to increase simultaneous users on a chatbot service that we were using already for student affairs and academic counseling. So we increased it, added 5 lines specifically for this. And we brought in 2 PhD students who trained students in these multiple technologies, from the chat service to Slack to Canva to all the various things we have to use, as well as hotline and sort of basic customer service best practices. It was very lucky that one of them had done just such work recently, and also both of them were extraordinary and took on an incredible task, and we would not be here if they had not done it, because they are amazing, and one of them is here with us. One of the key things was telling these students, do not give medical advice because you are not doctors and that is illegal, but also explaining all sorts of things about how you go about doing these things, from HIPAA to all the different kinds of trainings. They were learning in the way that any new employee would learn, but also they were learning on a sort of a meta level of what actually happens when we're doing this set of health communications. We had to keep it going because it turns out that remote learning was not going to stop. So the practicum, we had the practicum students create infographics. There was a newsletter, and I, conveniently had them all analyzing what they were doing, creating policy analyses of the program, which everything from should we be using Slack or not? I mean, the answer is always yes. But actually analyzing what they were doing and how they were doing it. We ended up assisting a large OC, Orange County and UCI COVID-19 surveillance study. There are further ones coming up, future ones coming up that we will be assisting as well. Everything from sort of answering questions to sort of on the fly assisting the people on the ground doing the actual blood tests and stuff like that. We also, the faculty, we found a way to get the PhD students paid because originally it was, do you want to help? we did desperately need help. We got them paid. And it has not been smooth sailing. Right now, they are helping, but are not being paid. But we did just hire a temp with actual money that was specifically done that, and she will work through the new year, and then we're going to see how long we can push that money and the administration. So what did the students learn? They learned interpersonal customer service communication in a sort of tense customer service health emergency. They did a lot of real-time problem solving because they had to answer any question that came in. Sometimes the answer was, we can't answer that question, but there was referrals, there was going through all of the information. They had to find things very, very quickly. They had to, a lot of teamwork and time management skills, figuring out how to get things done, having to do things with no one actually watching them from home. Lots of public health communication strategies, from one-on-one answering questions to public-facing writing and data visualization, from the newsletter to doing infographics, and really sort of seeing firsthand the possibilities and the complete pitfalls of emergency response communication, which is what we were doing. Not emergency response communication like an actual immediate disaster. This was a slow-moving disaster. But they saw something that very few public health students, especially undergrads, get to see, which is this incredible laboratory that we are existing in right now. And we learned a lot too. Our PhD students, the faculty members, and the people who supported us, a lot of technical things and practical things. You need a standard operating procedure. Once Sarah and Chantel created that, the training went so much more efficiently, and the responses were better. We instituted, used time management and shift management software, which we had never had to think about before. And that definitely decreased confusion and helped the students sort of maintain their practicum hours. And also, practically, if you need to get money, you have to harass the people with the purse strings constantly. Dr. Rennerstrom, who had the ear, did it constantly, never-endingly, and that is how we got people paid and got things done. There also, as the person who's been teaching this class and will be for quite some time, a lot of curricular and pedagogical things. This is something I've always thought was important, but I never had to do it so quickly, which was curricular flexibility that it really needed for practical reasons, but also it's really important to model this professionally to these public health students. They are going to be confronted with emergencies that are instantaneous. Maybe they're actually working in an ER, or pandemics, or natural disasters, or whatever it's going to be. That sort of incredible flexibility is important. Crises are, we constantly just like, this is an incredible experience, learning experience that we're going through. They are real life case studies, but we cannot forget that compassion, grief, justice, and fear should not ever become solely academic. We understand that people are scared, but we also are scared ourselves. And I think this is really important that, educationally, that we never ever divorce these things from real life. But also, knowledge has an undetermined infectivity rate. It can be very problematic, but we can really use students to spread this knowledge. And this is one of the things that we really believe in our education at UCI, which is that we are seeding the community with good information. And they are doing it. I always say my favorite thing to do is get students to come home and get and use their knowledge to confront ignorance at the dinner table. And this is really important for us to do as educators. And also, I think it's really important. You can do these things too at your institutions. This is a great way to manage, dealing with remote public health education, which is we are forced all to do it right now because of the pandemic. But there are so many distant learning programs where the administration and the faculty are really far away from where the practicum sites are, because the students are doing things really, this is a great way to use it as a teaching tool that is much more direct. And that is our icon for clicking through. And that's, I just want to thank a bunch of people. Our co-authors, Sarah Goodman, who is here, Chantel Nolan, Mariah Rennerstrom, the essential assistance of Rocio Gonzalez, who's our coordinator for the practicum sites, Sharon Robert, who handles the money, Dr. Bernadette Bodenobala, who is the catalyst for everything great at UCI Public Health, and made this happen as well. Our 90 so far students that have been for the practicum, the rest are volunteers since 2020. And then of course, all of you, because without you producing that information, we couldn't do it. And you've been doing it under horrible conditions with very little support. You are essential, so thank you. And that's the purpose, so thank you. I guess we take questions now, Toby.
It looks like there's a technical issue, maybe. Let's just wait a minute. I don't know.
Well, I can answer your question. How is
you might want to read the question out loud. Yeah.
Yes, that's what I do. So how is information selected and how is information updated during the rapidly changing pandemic and conflicting health reporting requirements and guidance? I will, one of the key things was having both Sarah and Chantel, PhD students, were constantly mining the information and deciding along with me and Dr. Brennerstrom was like, wait a minute, which is the most priority? They basically really figured it out and chose based on the skill set of really good PhD students, like what's the best information. We also had to realize that there are conflicting things based on the county you're in, the state you're in. We did get calls or chats from Missouri, from Florida. So we would say you have to defer to that. There was the specialized knowledge of definitely Orange County in California, but there was definitely, it was different depending on, and we would have, if you Google Orange County coronavirus, you will notice that there were week by week changes based on political pressure. So it was complicated. And we were sometimes had to say, yes, this is what you're being told is what the rule is right now, but you're best if you do X, Y, and Z.